Hi, everybody, and welcome. My name is Bradley Schleier. I am the VP of Sales here at HealthBook Plus. And first, I just want to thank everybody for joining us today. We really appreciate you taking the time. I think I need to put a very special shout out to Dr. Simran Malhotra for helping us really bring this webinar together and sharing it with her network. We're excited to have this conversation with a group that really cares deeply about it and really cares deeply about lifestyle medicine, patient engagement, and really helping people make lasting changes in their health. So today we're going to spend a little bit of time talking about how HealthBook Plus can support lifestyle medicine, direct primary care, really, and really other high-touch care models. So a lot of practices that we speak with are trying to do a few things all at once, and they want to deliver more personalized care, keep patient engagement between visits, and then make education and follow-up a lot easier, and do all of that without adding more work to that team. And that's really where HealthBook Plus comes in. So our goal is to support the provider-patient relationship and not replace it. So we want to help practices better understand the full patient story, make engagement easier to scale, and give care teams more time back to focus on the work that really matters most. One person I'm very excited to introduce here today is Dr. Amy Mechley. She's our Chief Clinical and Strategy Officer at HealthBook Plus. Amy is a practicing lifestyle medicine, direct primary care, family medicine physician. She is dual board certified in lifestyle medicine and family medicine and has achieved the status of lifestyle medicine intensivist and co-founder of her own direct primary care practice in Cincinnati. She also serves as the chair of the board of directors for the American Board of Lifestyle Medicine and International Board of Lifestyle Medicine. So Amy is going to help us set the stage for why this matters to lifestyle medicine. And we also have on the panel today, Ryan Wendling, our VP of Solutions and Success. So Ryan works closely with practices and partners to understand workflows, your goals, and really how HealthBook Plus can fit into a practice in a very practical way. So after Amy gets this stage set, she's going to hand it over to Ryan to walk through the platform and show what this could look like in the real world. So with that, I'm going to turn it over to Amy.
Brad, thank you. And thank you for your energy. So Brad introduced me, and I am one of the OGs, and we laugh about that in lifestyle medicine. And I would bet some of our stories in lifestyle medicine, or we were doing lifestyle medicine before we knew it was called lifestyle medicine. And then when we found our colleagues in lifestyle medicine, we say, we found our people. I have been working with HealthBook Plus particularly for almost a year and a half, 2 years. This is, I feel like, a culmination of my career. I've been a physician for almost 30 years now. I've been doing lifestyle medicine for about 18 to 20. And again, I'm early on with some of the, I'm not a pioneer. I would never talk about that. We all know who our pioneers are in lifestyle medicine in the US. But I was there early on, and it has been an absolute honor just to watch this thing explode. And the reason it's exploding because we're all saying this is what we want to do. This is where healthcare should be. This is how we want to serve our patients. So without further ado, I'm going to go through these slides relatively quickly because I want to get to the demo of the product. I have been using this for my lifestyle medicine practice for over a year. Like I said, I've been interested in the company for about a year and a half. And so I use this on a regular basis every day. And you can quote me, will not practice medicine without it anymore. It puts us at such a vulnerability not to have information on our patients and not to have good information at the time that we need to be practicing. It is unethical in some ways that I feel like we're practicing in a void from our patients. But what this platform you'll see does is not only bring together the traditional healthcare information, which is what, even with AI embedded in our EHRs and everything else like that, great, super. Everybody should be using it as a task-oriented. We want to make sure we use this AI tool ethically, appropriately, and then we give access to our patients. So their mental health isn't being worsened by them Googling or ChatGPTing or whatever they're doing. We are now in the era where we can start really practicing more personalized healthcare, and it's just going to grow. And how we use AI and how we use this tool is critical. So I am super excited you guys are all here and can't wait to continue to work collaboratively on this because, as I said already, we're better together. Okay, so I'm going to flip through the slides because we want to have time for the collective. So what I'm going to focus on, and there's so many things we can talk about, but specifically is how AI-powered lifestyle medicine. So again, the core is lifestyle medicine, the core is relationship-based medicine, and we're bringing in AI as an infusion and as a tool. But what can change operationally, clinically, and financially? Because if we can't get this and sustain these lifestyle medicine practices, if we're all altruistic, that only lasts so long. We need to make sure our value is known and we're efficient and effective in what we do. So again, here's the gap. And this is the gap. We can talk about this in medicine in general, but specifically focusing on lifestyle medicine. The promise, again, the reality is we have fragmented data. We have very siloed workflows. Our patients are over it. There's like, I can't believe you didn't know I was in the ER, or that I didn't have celiac disease, or I didn't have whatever it is. They think we just know this. We have visit-centric models, and it's like this transaction. You walk through my threshold, I do something for you, you go away. Bon voyage until next time. I don't have a tolerance for that, nor do they. So we need a platform that supports that. And as we know, lifestyle medicine is a team sport. Well, what does that mean? We don't have the finances to hire, because that was my original goal. I was having 3 locations. I was going to have 11 health coaches, Well, I started with another doctor, and I was drawing blood. I was doing vitals. I did it all until we grew. So we know that we need a team, but how might we leverage this to make sure everyone on our team is the most impactful and efficient and are not doing task-oriented jobs that we don't need to be paying anybody to do anymore from that perspective. And again, I think this is a significant solution where we have continuity of care between visits. We have behavioral change at scale supported by something that actually understands the person. Again, really important key factors here. And again, it's longitudinal, it's relationship. So our promise to our patients, whether you're doing, intensives, shared medical visits, you're selling packages for lifestyle medicine, or what I do is I do both, and then I do full lifestyle medicine infused primary care now. So even when somebody comes in with a URI or an ankle sprain, I sprinkle lifestyle medicine all over. We don't have to hit all pillars, but we sprinkle it in. Okay, so how do we do this? So this is where we focus on the continuity, the context. So you'll see, we'll talk about PaiGE. PaiGE is our agent. I think she's a she. I talk to her every day. She knows me well, but the key is she knows every single one of my patients. And so I go into their specific arena, and I'm playing and asking PaiGE, and she's supporting me in this, but she has been trained in lifestyle medicine, guys. We have put in evidence-based, and PaiGE stays in the house of medicine. PaiGE will not go out to a chatbot. She will not go out to an Instagram page. She will not go to any internet source where all the other AI doors that we have will. Open evidence is a great place that won't. So open evidence is, if you guys aren't using that, it's a great place for physicians or clinicians or people in healthcare to go. And it's shut down only for clinicians. I love it, but it's not personalized. Great. Again, I love open evidence too. It was like anybody who's not using that, I'd be like, guys, come on, it's really juicy. Again, we have to be thoughtful. AI is a way to get us information. It doesn't mean that information is right. So we have to make sure the source is right. And open evidence does, I think, a decent job. What we have built inside of HealthBook Plus, PaiGE, also is in a curated environment. Will not go outside of that. But the key here is she has all the information for your patient and then is able to translate in a way that you would like. And she's fully embedded and continuing to grow in lifestyle medicine. Again, it's more of a clinician support. So let's go and look to see. We wanted to do a demo. I want you guys to meet Chris Walker and tell me if you know Chris Walker. All of you know Chris Walker. Okay. And Brian's going to run us through Chris Walker. So he's your typical lifestyle medicine patient. He's 46. He has been working his tushy off. He is running a company. He's also remote, let's say working in a startup. So he's one of those people that used to be athletic, but has been sitting for the last 8 years more and more because he's on a computer screen. Really intelligent, very engaged, wants to be healthy, but has yet to engage in any of that. And we're seeing his metabolic profiles just slide. And we're going to talk to you about that. So typically we'd see him every 3 to 6 months. He's got lots of goals. So if you did a lifestyle medicine assessment on it, you'd be like one thing at least in every 6 pillars. So typically, where do we start? We never want to overwhelm our patients. So we have to meet them where they are, understand their why, use all of our motivational interviewing and say, what's going to work for Chris? And it's not cookie cutter. Because if we keep saying, I'm going to do the same thing for everybody, people are like, I tried that. I didn't do it. I tried that. I'm failed at this. I did a diet. I mean, I did this, and I'm so sick and tired of being sick and tired, and nothing's helping. So, Ryan, take it away. I'm going to stop sharing. Are you ready to share?
Yeah, absolutely.
And then I'll come back just for a few more points.
Perfect. So hopefully this will show up for everyone. Is everyone seeing that?
Hi, Chris. Yeah.
Awesome. Yeah, so this is Chris. So what I'll do here is kind of walk you through kind of a typical workflow and how our system provides you with so much insight into what's going on with these patients when they're outside of their office, how that corresponds to some of their medical conditions, everything that's going on, and allows you to really take a more holistic approach to care, which is obviously the reason all of you have gotten so involved in lifestyle medicine is really getting to that level with your patients. And I'll do this kind of just by walking through a typical way that a clinician might be leveraging the platform as they're working with a patient as part of a visit. First, though, I'll just kind of lay the foundation so that you kind of understand where all of this intelligence is coming for PaiGE. We are really expert at bringing two pieces of a picture together on a patient, one of which Dr. Mechley talked about earlier is what we call the point of service data. And so this is all of that traditional health records, labs, all the typical stuff that, anyone in healthcare is used to looking at. And we've got some incredible ways to bring in all of that information and get really good context from what's going on from a healthcare perspective with this patient. And so we've got links into the National Health Information Exchanges. And so for any patient that's inside of HealthBook Plus, you are generally going to start with a really great core foundation of medical records. They're waiting for you, labs, they're waiting for you. And so that can be just incredibly beneficial on laying a strong foundation of understanding for what's going on with someone. We've then got EHR integrations. We've got, fax on behalf of patients if it comes to that. If they went out to some small town doctor that doesn't have a connected EHR, we're sending faxes. Either you or your patients can upload documents. So moral of the story, we create this multi-tiered approach to getting a really strong understanding of what's going on with this patient at the point of service. But then where we really create this holistic picture is by leveraging and combining what we call the point of living data, which is, okay, cool. Every 6 months that Chris is in the office, we might get some more information, a new diagnosis, he might go on a new medication, but the core and the foundation of his health is really being built at home. And so let's start getting an understanding of what's going on with him day to day. And we do that via both structured and unstructured data, which includes wearables data, connected medical device data, journal entries, assessments, journeys, which is kind of our version of programming as they're working on those journeys. And so all of this comes together and gets combined with that point of service data to really give us this incredible view and understanding of this patient at a very core foundational level, which then allows us to, help them make these positive strides in their health. And then the cool thing is over time, as they're working within their mobile app, there's two sides to our platform, I should mention. We've got our clinician portal, which is what you're seeing here, which is web-based, and then your patients have a mobile app that goes with them day to day. So as they're engaging in that mobile app, it creates kind of this cyclical approach where your input is coming into the system. It's being combined with what's going on with them on a day-to-day basis. They come back into the office or have a telehealth visit with you, and then you kind of adjust and move, and this cycle continues, and it allows them to just make continual improvements in their health that really they've never been supported like this before within the healthcare environment. So with that, let's say that Chris is getting ready. He might be coming in with me. We might be having a telehealth visit here shortly. The first thing that most of our clinicians will do is they'll run a recent activity on Chris, and this can be set to whatever time frame that you're interested in. And what this allows you to do is just really get a quick, deep understanding of what might be going on with Chris since maybe the last time that you saw them. And so this is pulling from all of that point of service, all of that point of living data, and kind of at one brief glance, I can get a really good understanding of where he's at and where he might need support. And because this is a demo patient, you don't see a ton of kind of point of service related information, but a lot of times this will also pick up on potential visits that you might not have ever been aware of. We've had cases of it, documenting that they had gone and seen a cardiologist and had a change in medications that they didn't even think to tell their primary care about, right? So you could see what's going on. Oh, Chris had an ER visit 4 months ago. He might not be coming to see me because of that, but it's sure helpful that I know that and I can dive into that a little bit. So super powerful just to kind of lay a great foundation. We've also got an AI note taker that is super well integrated into our platform and comes with it. So most of our clinics are leveraging this as well. They come in here and start that AI note taker right at the start of the visit. And then honestly, the bulk of what you're doing is teaming up with your partner PaiGE and asking whatever questions you might have on this patient. And so I could come in here and say, let's just start from a super basic level, give me any diagnoses for that should be considered for Chris, right? So the system, instead of you going and diving through charts, diving through information, diving through PDFs, you just are able to have this very fluid conversation with PaiGE that can continue building on itself, and she'll kind of help you move down pathways and move in directions. And you'll see this come across, but this is kind of the most basic use of the system. You can really go super far in terms of what am I missing? Give me a care plan, give me this, give me that, and I'll kind of show how some of this works. So very quickly, I can screen through here and, like Dr. Mechley talked about, prediabetes, obstructive sleep apnea, fatty liver disease, this typical profile. I can then come in and say, let's try something else. What patterns or connections might be missed in this patient, right? The systems.
And the way,
yeah,
I'm
please.
sorry, the way that I work on this, sometimes when I get to PaiGE, because I do almost PaiGE forward first, that pop out, if you want to do the pop out, because it's even easier to read. So I usually sometimes I'll have a split screen with my EHR, and sometimes I just stay here. So yeah, thanks.
Yeah, absolutely. And so, you can make this big, you can take it over to a second screen, you can kind of do whatever you want with it. And so you could see here that PaiGE is really picking up on things, and that combination of that point of service data and what's going on with them medically with, okay, what's going on with them on a day-to-day basis. And then you as the clinician can then go, oh, we've got some spots here that we can really make some positive impact on. I could come in and say what additional evaluations would be helpful.
So yeah, right where you're doing that, I just want to say, so again, what she's doing is based upon your questioning. She's bringing all this information together. So I think of it as like this eager med student who's sitting next to you, who's like, what do you want me to do? What do you want me to do? And you have to be like, I want you to do this. And boom, they'll bring you the potassium. They'll bring you this. They'll bring you this. It's realizing that she is just like this eager beaver, and you just need to ask those questions, but you can see it's really bringing in patterns for lifestyle as well as the basics. And then what is it supported by? Well, the hemoglobin A1C went from this to this, and these are the evidence. This is the evidence, and then kind of showing you where she's getting the documentation from. So again, we worry about AI, about saying, hey, is this real? Because I'm not going to go into the patient's room and say, this is the pattern I'm seeing. They're like, what are you talking about? Or that wasn't, this is what, again, I got like about open evidence. She's saying, this is what I'm seeing. This is possibly related to this. And this is where I'm drawing the information from. That is key if anybody's working with AI. Sorry. Thanks, Ryan.
No, that's a great point. Yeah. Thanks for hopping in, and please continue to do so. So you could kind of see how all of this works. And, the really cool thing, let's say you're in the visit with this patient now, something comes up that the patient brings up in the middle of the visit, right? At any time, this can go in a totally different direction, right? Okay, well, what can I really do for my sleep? Well, let's ask PaiGE. Or, What should I be considering diet-wise? Oh, I can ask PaiGE that as well. So it's just an incredible partner for you as you start thinking through options, what might be differential diagnoses, what might be a care plan that could be recommended to this patient. It's just always there by your side and pointing things out and trending information that allows you to really draw deeper insights on your patients. But where this really shines is like I talked about earlier, is once you then close this loop back to the patient and allow them to go out into their day-to-day lives with additional support than what they've ever had before. And so in doing that, one of the options with PaiGE is I can come in here and say, give me patient instructions for Chris based on lifestyle medicine. Let's do 5 bulleted. Keep them simple, and then patient language, right? So I can also now get prepared for him to be leaving my office, and you'll see this come back, and this just kind of highlights this being able to close the loop, being able to send them out into the world with support that they really need to be able to make these positive changes. So you'll see this in here, and it gave me citations, which is great, but not necessarily something I want to send out to the patient. So I'll just tell her to remove the citations. And so this kind of collaborative, much like I'm sure you all are working with the ChatGPT or any of these AI engines out there, you can really ask it to do anything that you want. I could be asking to trend the HbA1c. I could be asking how his HbA1c seems to correlate with his weight over time. You know, the possibilities are really endless. So let's say that the visit's now done. I can now provide Chris with those patient instructions, right? And the cool thing about this is Chris will, in his app, then get a ping that says, hey, you've got new patient instructions. And Chris's entire experience within his application is now adapting to what the system knows he's working on with his clinician. And so when he's logging in every day, he's getting journal prompts that's saying, hey, you know, how's that sleep training going, or the sleep practices? How's that doing? Or, hey, you know, how are you doing with your alcohol consumption? Have you picked a couple of days that you might want to skip skip alcohol on? And so once again, it can really just go out into the world with them, keep them, I don't want to say compliant, that sounds a little bit too rigid, but keep them making these positive steps that you're trying to work with them on when they're in the office. You'll see kind of a bunch of tabs here. I'd probably, just in the interest of time, and I want to leave time for any questions that are coming back from the group, but just know that there's, you can see the assessments that they're taking in app. It does some proactive health monitoring. And then one thing that I'll show here quickly, but then also cover quickly within the app as well, is our journeys feature. And so you can think of these as programs that you can set up, and we've got some standard ones that'll be coming with the platform here shortly. But these can be assigned to any of your patients, and this programming is delivered out to these patients, but where it's super unique in comparison to maybe some of the other platforms out there is that the patient can then come in here and can actually interact with PaiGE on the information that's being delivered to them. So let's say that a YouTube video was delivered to them on building your plate, for instance, this day 2. They can then ask, okay, how might this help me avoid my diabetes? And you'll kind of see this on the app side. And so instead of just being standard programming, like let's say that you have a diabetes journey. A diabetic's not a diabetic. It's not a diabetic, right? Somebody that's well controlled is very different than somebody that's really struggling. And so PaiGE is actually able to adapt to those circumstances and better support the patients based on their own profile. So I just wanted to point that out quickly. We've also got a full conversations platform, and this is really neat too. So I do want to highlight it really quick, and I'll go to a different view so that we have a little bit of extra room here. So patients now are out there in ChatGPT. They're out there asking all of these medically related questions. In the HealthBook Plus world, they're chatting with PaiGE directly and are in this very well-controlled environment. But the cool thing is let's say they have an hour-long conversation with PaiGE. They're really diving deep. They're looking into peptides. They're trying to figure out what the next wave of medicine is, whatever it is that they're asking about. Once they get into this, and especially if they're moving toward, treatment or diagnosing themselves or making, talking about changes to medications or anything that really isn't appropriate for a chatbot to be, supporting them with, PaiGE will actually come in here and recommend that they add the clinician into the conversation, or at any point they can add the clinician directly. And PaiGE will actually button up their entire conversation, combine it with any related health records, related data that might be good for you to be aware of. And then when it comes over to your inbox, you've got full context. You know what this patient's been talking about with PaiGE. You know why they're thinking about these questions. You're not sitting there asking 50 triage questions to try to get to the bottom of what they're thinking about. And so for you, it can make the answer a whole lot more simple, where I can come in here, I see the whole overview of what Chris was talking about, and I can just come in here and say, yeah, agree with the recommendations. Let's get together next week to chat about this, right? It just, instead of it just being these one-off texts, it comes with full context, but the patient's also getting the support that they need out of the office at the same time. And so just wanted to highlight that quickly. I will now switch over to our mobile app, and I will keep this fairly quick because I know we've got a lot to cover today, but I do want you all to be able to see what the patients are experiencing in being able to work with PaiGE on a day-to-day basis. So while that's pulling up, awesome. And Amy, sorry for forcing you to stare at yourself. So this is the patient application that gets rolled out on the patient side. And you can see, PaiGE is right up front and center. They can come in here, ask questions about their health. PaiGE is there to support them on a day-to-day basis, meet them exactly where they are. I'll also highlight these observations, right? So every time that somebody logs into the app, they'll receive a personalized observation on their health. And this can be things that are combining their medical conditions with what PaiGE is seeing day to day in the point of living, with trends, with, hey, did you realize that it seems like anytime you're not getting good sleep, the next day you really struggle with your exercise, or maybe it's vice versa, you're not getting any exercise and that seems to lead to you really struggling with your sleep. So these sorts of things can just keep people interested in their health, but also, seeing things that they're probably not thinking about, and being able to continue moving them in a positive direction in their health. Like I talked about on journeys, right? They can always come in here. They're waiting for them, they're set up day to day to be able to support them and to help them learn. And kind of like I talked about, right? I, as a patient, can come in here and I just watched this Build Your Plate video, and I could say, will this approach help me avoid diabetes? Any other changes I should make to make sure I don't continue declining, right? Very, very logical question, but PaiGE has all of this patient's data, right? So she can appropriately support this patient when they're not in the office and when they're out there in their day-to-day lives. It picks up that maybe they're drinking a little more than they should, and can be there to support them in that. And then, sleep and stress. And once again, you see kind of throughout everything that we do that lifestyle medicine is just totally ingrained into the way that PaiGE is trained, and the way that we release features and support patients on a day-to-day basis is just always lifestyle medicine focused. And I'll just add, I mentioned journal entries, so they can also come in and just document how they're doing on a day-to-day basis. They'll get journal prompts based off of the patient instructions that you're setting for them. But you'll also see, some things that are probably very familiar with you all in these lifestyle medicine pillars that we also track over time. And so it's really interesting when you combine, this is just a qualitative metric, right? It's just a 0 to 10. But when you start combining this with the medical record and some of their quantitative data, maybe coming from wearables or connected medical devices, it's pretty incredible the types of insights that can be gleaned from all of that information. And since PaiGE is just sitting there day to day, all day, every day, processing this information, looking for trends, it's really awesome, some of the stuff that comes out of this, both on the patient side, but then these insights also come out to you over in the clinician portal as well. So wanted to highlight that. Sort of some foundational value for patients is they will also have all of their records with you. And obviously this is really core to building a foundation and understanding that patient, but it's kind of got some inherent value. I ended up in the ER back in December, for instance, and it was in a health system that I had never been to before. They didn't have any of my medical records, and they just immediately started treating me, right? They assumed it was an acute episode. They went in there, started treating me, barely asked me any kind of questions. And I was able to kind of say, whoa, like, let me at least send you all of my records. And the cool thing is when I exported this, it also had some summaries on what had been going on with me in my journaling over the last 9 months prior to this. And it actually made them realize, okay, this isn't just one little acute instance. I had been kind of struggling with this issue for a long term. And so putting this power into your patient's hands and allowing them to go throughout their lives with this is also just incredibly powerful, and allowing them to better manage their own health, but also own it from a real foundational level. And so I'll probably stop there so that we maintain some time for questions. But the real moral of the story is that this system can really help you deploy lifestyle medicine out to individuals where they need it on a day-to-day basis, but then also close the loop as they come into your practice, and allow you to really support them in the way that you all truly believe in. And so I think we've seen it. Everyone that's downloaded the app themselves have seen the kind of support that they've gotten and the positive steps that they can take. So with that, I will hand it back to you, Dr. Mechley.
Ryan, thank you. Thank you. And I will, I'm going to go back to sharing my screen because I just want to get through these few slides real quick. But I want to just mention, because there are things that as a clinician, I'm like, oh my gosh, and I wanted that you guys picked up. One is that note taker is a scribe. So that has saved alone at least, and I'm not kidding, 1 to 2 hours of my time. I'm not a great typist. I'm an old doctor. I don't feel old at all. I feel like I'm just getting started. But I am, even though I took typing in high school, and I did take, that's how old I am. I took typing in high school. I don't type very well. I could write in a chart, and I would not break eye contact with the patient. So when I go into my room, I have the AI scribe, the HealthBook Plus scribe going. I set the computer to the side. If I need to grab PaiGE, she's right there, and I look directly into the patient's eyes. That has been a game changer. So I can just tell you, and they capture our conversations, and the note is done for me to review and edit, because you never just want to blindly put that in there. So that, again, just from a functionality perspective. But I'm going to actually, so it goes right to the slide, the economics of medicine. So we want to make sure HealthBook Plus improves care. It doesn't get in the way. Almost every tech that we've had, and I've seen a lot in this 28 years, has never really been built for our workflow. It's been built for billing. It's been built for legal reasons. It's been built for other things. This truly is foundational to what our workflow and how to empower our workflow, because our value is not going to see when their last colonoscopy was. Our value is in our relationship and how we can help engage with our patients and focus on the right things at the right time. And that's really, really important. So just by doing that is huge. The second is waste, because we're not going to be reordering tests or not having, if we have any available data for that patient, we're going to have a much better idea and focus. And I can go on, but it's really time, and then the value of my attention. those two things, attention can only go one place, and time, we can't create any more time. So how do we leverage those? And then I already kind of discussed the team approach. So we could talk a little bit more about this, but just from what Ryan was saying, it kind of triggered some of those thoughts in my head, looking at this from a provider perspective. So again, time efficiency, panel capacity. Some of the questions are, what we do in lifestyle medicine is really important, and it's a little bit more of a high touch. So how can we truly scale this without losing that? Well, this is a way of doing that. Again, you're focused on the right things at the right time, and we're not adding to burnout. I was a faculty member for 8 years for a national conference that was sold out every year with crispy doctors that were more than burnout. And it was called the Wellbeing Conference, and we were focused on that. So I'm very understanding of the science and evidence around burnout and what we need to do to create resiliency, but still be doing the jobs that we feel like we're made to do. Patient retention. One of the things I wanted to mention is Ryan showed you that app, the application side. So this is a full platform. This is an end-to-end solution. The application side, on the patient side, will have your name and your potential logo or your face. So it truly is an extension of you, which is very different, because a lot of the patient portals that we use and things, sometimes it has our little picture up there, but this, you will say, as part of my practice, you will be on this platform, which you will be able to see as a patient. Here's all of your available medical records. You will have access to all of that. So, oh, by the way, if you do go down to Texas and you are in an accident, you have to go to the ER, you can say, here's my medical records. I don't care what these people are thinking, but no, I am on, a blood thinner. I am on, these are my correct medications. So it's a value add regardless of what we do in lifestyle medicine, because the patient's now empowered to be the truly patient-centered control over their care. But then in addition, they know when it's PaiGE, because we don't want them to confuse to say it's Dr. Cimarron giving me the evidence, this advice. It's PaiGE talking to you. But now I can bring in Dr. Cimarron, which is really important. And then it truly is more of an extension of you. So again, from a retention, it's not just episodic care. It's saying, I don't really want to leave this practice because they're giving me advice in between, because so many times my patients are like, well, I didn't need to see you last month. Do I still have to pay you? And I'm like, well, that's the way direct care works. It's a flat fee and you have open access. So it's a nice way of kind of having that value add in between. And then again, we need to be focused on outcomes. My whole career has been really looking at that quadruple aim, and healthier people spend less in healthcare. We want to make sure that economically we're driving to real, true health outcomes, and it's one person at a time. So this population-based health, which again, I was a big part of, great, but we need to do it one patient at a time. Now we can do things, from the Blue Zones perspective, we can create environments that are healthier, absolutely. But again, this is truly meeting patients where they are and then keeping them engaged, because as we know, as lifestyle medicine practitioners, it's the day-to-day decisions that drive health. It's not the big, I got my colonoscopy. That's great. That is very helpful. But where are you going? What are you doing with your feet? Dr. Katz used to say feet, fingers, what was it? Feet, fingers, feelings, and something. There's the 4 F's that really drive a lot of our health. So this can be adapted for all kinds of models. And again, the model that I use is a financial model that supports my ability to practice primary care that's infused with lifestyle medicine. So mine is a direct care practice, and it's a membership, and I take care of patients of all shapes, sizes, ages, demographic. A third of my patients have no insurance. So I'm meeting people literally where they are from that perspective, and we can create these environments. Traditional primary care definitely can be applied here. Intensive specialty episodic care, if some of you I think are more of you're focused on lifestyle medicine focused practice, maybe are not practicing the primary care or emergency room or rheumatology or wherever we all came from. Again, it can be focused on these journeys. And I'm so glad, Ryan, thank you for showing the journeys. We might talk about those a little bit more, but it can also do disease specific. So if you guys are already running like diabetes shared medical appointments or, well-being programs that are becoming really popular, and your patients are engaged in them, that can go through this platform too. So it can be adapted for a lot of different areas. So again, as you guys can tell, lifestyle medicine is absolutely my world, and as it is your world. What we were looking at ACLM, the American College of Lifestyle Medicine, I was part of that from early on. The first 5 to 7 years, it was really saying, we need to really put forth the research, the evidence, the science, so people know about lifestyle medicine. So we were shouting from the rooftops like, hey, pay attention. This is the strongest medicine out there. We shifted the focus to say, now, how do we, since we all know that, how can we take that and put that out into the world, to ourselves, to our patients, to everyone they serve? Every stakeholder in the medical field should and can be touched by lifestyle medicine. So again, as the board chair, I obviously look at certification, training, and competencies, but a big focus, and I think all of us understand this is nice if it just sits there in a box. We have to get this out to everyone, and we have to get the strong message and a similar message. So we're not fighting about, is it this type of oil, this type of oil? Okay, we're still talking about Twinkies. We don't need to go into the tiny details when we just really need to get good evidence-based medical care in the hands of our patients, supported by us as professionals, excellence in this field. And I obviously believe this is definitely a way to do it. So I'm going to stop sharing and throw it back to Brad. And we did good. We've got at least 15 minutes, 10, 15 minutes. Yeah. Because this is where the juice is. Yeah. What are you guys interested in? And Brad, I say this all the time.
We do have a few questions that have actually come up that I've gotten sent. We can go through those. And then if there's any other questions, we can open up the forum a little bit and see what everybody has on their mind. So one question that came up is, how would this support my practice as far as more patients or keeping patients connected to my practice? Any specific ways which this has helped other practitioners in lifestyle medicine?
Yeah. Oh, I love that question. That's great. So as I mentioned, it's branded, and I say branded, meaning that it's an extension of you. You're not giving this as another app, another tool, because there's, again, if you guys saw my website, I've curated a whole lifestyle medicine page where I recommend recipes or different apps like Michael Greger's app, which I love. There's all this stuff. This is truly an extension of you and your practice. This will the way that other people have used it, and I like that follow-up question, is I use it every day from on the clinician side. So I walk into the room more intelligent, more focused, and I really understand most of the time where the patient is. So that has helped me. I would sit here and tell you, I've had 6 major wins of diagnoses that I would not have come up with at all, because I'm asking PaiGE, why is the thrombocytopenia related to anything that's been happening? And PaiGE will tell me, actually, this medication or this supplement can be a cause, or if again, I can say I'm a really good doctor. I've worked really, really hard at it. That is not all up here unless you show it. I can start to see patterns, but PaiGE sees patterns that I don't recognize because she never forgets. And she's in that patient record. She's not going all over. She's in the patient record, pulling all this other stuff in. So again, from that perspective, patients appreciate what I can bring them. And then it supports that longitudinal journey. And you will see some of my mental health patients use that journaling all day long. You can just put your microphone and they can just talk to PaiGE. So it's I could go on and on, but I think that's an idea. I think it keeps that value add, especially when we're in lifestyle medicine, where it's hard to talk about revenue and billing and things like that. So when we're in different models, it really brings this to the surface, and people are my patients are super excited. They'll use it. So they'll use PaiGE and they'll say, hey, I'm going to my cardiologist. Give me the top 5 things I should ask during this cardiology visit and summarize my records so that I can show it to my cardiologist. Boom. They are empowered by their care. They're showing their cardiologist, because some of those consults are I got a consult one from a neurologist, and she didn't have a stroke. I'm I knew she didn't have a stroke. I'm wondering what's causing the tremors. I was come on, guys. So it helps us work as a team better in that field, but supports the patients too, so they feel like they're getting the best out of whatever healthcare ecosystem that they are particularly in that is truly patient-centered. Okay.
Ryan, this one looks like it's for you. Are the journeys all canned, or can I edit to make it more specific to what I focus on in my practice?
Yeah. And I'll kind of combine that with another one I'm seeing from Wendy. They aren't all canned. We have some that are kind of pre-built, just that, you have something to kick off with. But we can basically build them, and it's super quick and easy to do with the help of AI. we can get those built in collaboration with you super quickly and in the fashion that you want to appropriately support your practice. And then the kind of similar question is, what format are the videos within the journeys? Currently, the way that we usually see it done is it's a link out to any YouTube posted videos. And if you don't want those public, we just leave them unlisted. And the only way that people can access it is through the link within HealthBook. We are working towards embedding those videos in the player, but YouTube's so good at it that now we just kind of redirect over there. And then another great question while we're on it from Wendy was, does PaiGE communicate in the same manner / style as the clinician? Does she have her own style? So really good question. And we've got actually basically a brand new feature that's coming this month, which is like org references, basically, which is where you can provide PaiGE context as to how you want her to respond. You know, I'm a lifestyle medicine clinician. I like avoiding these things. I want to encourage them to do these things. And so you can really get her as your voice when you're not actually right there. Yeah, 100%.
There was another one that came up in the chat. Is the platform available for other countries in other languages like Spanish?
Not Spanish yet. We can go into some other countries, but it's all English currently. With that said, that's also been on our pretty short-term roadmap as well. So if there's a urgent need that needs to be filled, please reach out and we can have that conversation on trying to get it into some of those other languages for you.
Yeah, and I'm going to actually put my email directly into this chat. And then we'll send it out as well. In case anybody has any questions that may come up afterwards, feel free to reach out to me and I can absolutely help you.
And then, yeah,
I
see, can you create meal plans, or is there a meal planner software? Yeah, ask PaiGE. And PaiGE will build meal plans. And the cool thing about it is she knows everything going on with that patient, right? So as she's building all of those, she's considering the entire patient picture. You know, did they complain about, you know, I like lifestyle medicine, but I'm not giving up meat. I'm not doing it. Okay, let's sneak a little bit of meat in there. Let's keep some balance in the diet. So yes, yeah, just ask PaiGE, and then you can put that right into the chat with them, and then PaiGE has the context on what they're working on as patients are out there in their day-to-day lives.
That's great, Ryan. So like when we talk about it too, because even though we all believe plant forward and plant strong is right for most humans, there is no one dietary plan that meets everyone's needs. So if you have somebody who's got hyperlipidemia and high cholesterol, and you say, I want you to focus on fiber, and they know they're going to be like, let's say, pescatarian or whatever, you can put all those things in. She'll pick up on it. But the key here, I think, to understanding is once you have PaiGE, you can almost do anything because you just have to give her the guidance. So she will pick up on things, but then you edit it. So, I mean, we're so used to saying having things like pre-built for us, which we want to do and we have done. Then you can start curating based upon mostly, again, we're excited on that patient side. And obviously demonstrating this, we've only been able to show you the skinny, like what we can do, because it would be overwhelming, all the different features. But I really find, just like with my iPhone in the beginning, I was like, I just use it as a phone, then I use it as a camera, and then I use it as a phone and camera, and I build things on it. I would say the greatest value is using PaiGE as your clinician partner in your practice. It gives so much focus and attention, and then allowing your patients to come on, and depending upon what your type of practice is, and bringing, again, if it's journeys, you're bringing your clinical, that content to them, and you're helping them in between, but then showing them how they can use PaiGE, because it saves me a ton of time. You know, a patient should check, I don't feel good. Can you tell me more about that? Blah, 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 blah. And she's got a validated full triage that is validated to do medical triage in there. But a lot of times she's just saying, and then sometimes it'll be like, oh, it was one of our colleagues, he had food poisoning, and he's like, PaiGE, I'm vomiting, blah, 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 blah. And she's like, tell me more. And within, I think it was like a few minutes, it wasn't very long because I watched this conversation, showed to me later, Paige was like, this does sound like food poisoning, and it does make sense, because he's like, I ate some funky tuna, da da. And she's like, this is what you would expect with food poisoning. If it's not this, or if it's outside of these bounds, please contact your physician. So she's never taking the place of that. And he's like, no, totally sounds like that. I'm just, blah. There was no other warning signs, symptoms. And within 10 hours, he was completely fine. And he was like, I didn't have to call my doctor. I didn't go to urgent care. Again, we want to be thoughtful, because Paige does not take the place of that. But she is able to, again, see patterns and talk to patients. And then, as Ryan showed, please loop in my clinician. I'm not reading reams of stuff. I'm getting like my RN who I work with, who comes in and says, Mr. So-and-so's got this, 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 and this. But when she does it, I just taken her out of any other jobs that she's doing. And this way it kind of comes to her. So I'm sorry, any other questions? Yeah.
Yeah, sorry, I did get a good ping that reminded me. So Paige will translate. And so I should have added this context before. So for instance, I can export my medical record in Spanish. If a clinician is communicating in Spanish, Paige will continue in Spanish. The patient at any point, if they're in Paige and having a conversation, could say, speak Spanish, and she'll start going in Spanish. So when I said that it is currently English, I'm kind of saying like the labels, the kind of pre-generated stuff will still be in English, but it's certainly possible to create, especially for people that want to do most of their experience in a different language. You can definitely create that experience for sure.
Ryan, we did get another question in the Q&A group. Does Paige give, Wendy, thank you once again. Does Paige give recommendations for evidence-based supplements, and obviously consider comorbidities, medication interactions, and blood results?
Yes.
Yes.
Yep. Easy answer there. Yep. Complete patient picture, and anything that can help is within scope. Yep.
Sure.
So yeah, 100%. And she's kind of always analyzing all of that. She quick. I mean, we've only got 5 minutes here, but she pointed out to me that I was just sick for 4 months straight, and I had this vitamin D deficiency that had been on my record for like 4 years. My clinician had barely pointed it out, was like, oh, you should take a multivitamin maybe. So of course I didn't know why it mattered. I never took it. I didn't care. But Paige was like, hey, like, you keep getting sick. You're like not paying any attention to this. Like, that if you get that under control, that might help you out. There's some studies that indicate that it might help. And I'm like, oh, that's why it mattered. Like, I've been going through my life for the last 4 years and like didn't even understand why this might be important. And in one fell swoop, Paige is just like, hey, pay attention. Stop. Stop trying to do everything else. Let's get to better health. So yeah, just a fun little side there.
Awesome. Well, guys, I know we're coming up to the top of the hour, so it doesn't look like there's any more questions in here. So what I want to do is I want to thank everybody once again for coming on here. I really do. I think this was great. We really appreciate you guys taking the time. We know you're busy, so to say it's appreciated is an understatement. Hopefully this gave you a really good feel for how HealthBook Plus can really support the lifestyle medicine, direct primary care, any high touch care areas or care models, help you save time, keep patients engaged between those visits, and really make that full patient story easier to understand. I think the main thing that I want to leave with you is this. HealthBook Plus is not here to replace the provider-patient relationship. We're really here to support it. We know that, and Amy can attest to this, lifestyle medicine's personal. It's going to take trust, education, consistency, and definitely follow through. So our goal is really to help make that easier to deliver and easier to scale. I do need to give one more very special shout out to Dr. Malhotra. Thank you so much for really helping to bring everybody together in this group and sharing this with your network. And thank you once again, everybody, and look forward to continue the conversation.